Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about frequency between orthodontic adjustments for Straightwire or braces cases. And I'll be glad to tell you what I do. There is no wrong or right answer to this. It's only what you feel comfortable with. So let's go over that. So this is kind of how I do things, and this really developed, I guess, over years, figuring out what's most efficient, what's most productive. The biggest mistake you can do is to get your patients in on every 4 weeks or every month, and that is just dumb because you're just completely throwing money out the window. There's just no need for that, and it's actually not even healthy for the patient. So, I really love the idea of using some virtual appointments in between too, and this is just a whole nother rabbit hole we can go down. But to at least look for broken brackets and hygiene issues, because clearly those patients need to come in more regularly. This frequency that I'm giving you is a frequency for patients who are compliant and healthy, okay? So you need to really figure out who the other the outliers are, and you might have a different frequency for them. And also really educate your patients and parents to check their braces regularly, to be checking for hygiene, broken brackets, broken wires, and to give a call sooner and not just show up for the regular appointment if something is broken. That's really important. So let's say on a regular bracket and wire case, what would I do? Well, if you've watched my other videos in terms of wire sequence, you know that I always start with the biggest possible round wire that I can get in. It's going to be different on every single patient. So a patient like this might be in a 14 niti. Someone who's pretty straight already, not this tooth, might start out in an 18 niti. Biggest possible round niti that I can possibly get in. That first wire is probably going to stay in for a few months, 4, 5, 6 months. It might stay in a while, maybe 2. That wire stays in. Let's say we started with a 16 niti. That wire is going to stay in until that wire is no longer deflected and is quite passive. And you don't know what that means. You need to understand that. That's a really important concept. So I recommend that you go to my YouTube site, not your YouTube site, but go to yours, put in the search bar StraightSmile Solutions, go to your YouTube site, which will have a green banner. Then go to the little bitty magnifying glass in the top right, not top right corner, but just top right in general, and put in deflection or deflect, and that will take you to my videos or arch wire sequence, which explain more about that, so you understand that concept. Once that wire, and you can see here clearly this wire is still deflected, right? It doesn't look like it's the shape of the arch wire when you put it on a tabletop. It's got ins and outs and ups and downs, right? Whereas this wire is not deflected, it's just straight, okay? So once that wire is no longer deflected, we're going to move up to 18 niti, unless that's your initial wire. Once that wire is no longer deflective, then we're going to do a really, really deep dive into bracket positioning. I also take a progress panoramic x-ray at that time, and I evaluate my bracket placement. Now, if you're a general or pediatric dentist, I strongly recommend that your first 50 to 100 cases are indirect bonding. That is the biggest mistake that general and pediatric dentists make, is to try to direct bond their cases. You will not do it right. I'm sorry, you won't. I've been working with dentists who are learning to place brackets some people have been doing it for decades, and they're still not doing it right. You just don't have the skills of an orthodontist, so why try to be one? Have a software company, have people who know what they're doing, place them for you, create a transfer tray, and slap them on. That way you don't have to worry about it, because I can guarantee you it will just make your case take at least another 6 months. It won't be efficient. And you'll be throwing money out the window because you're having to go back to other wires, you're having to replace brackets and things like that, and the patient will be unsatisfied and unhappy because of all the back and forths and how much extra time it's taking. So just use the indirect bonding. If you don't know how to do that, I'm glad to introduce you to some of the companies that I work with. One of the ones that I work with best does not really have a big website or anything like that. It's a referral-only company, so they need to know who they're getting. And so I'd be happy to see if you're a good candidate and refer you if I think you're a good fit. They charge about $350. That is for top-of-the-line brackets, 3M Unitech Victory Series. That includes upper and lower full set of brackets and the software to place them. And you will actually see the placement, you will approve it, and then they will 3D print the models, put the brackets on the models, create a transfer tray, and you will be shipped the brackets in the transfer tray. All you have to do is etch, prime, bond, slap on the tray like you were doing some type of matrix for a crown, light cure, peel it off. It is crazy easy. A monkey could do it. That's how easy it is. And you don't have to worry about the bracket placement because it did it for you and you verified it already ahead of time digitally. So now your assistant can put the brackets on. That's the beautiful part. You could be doing something else in the same room and your assistant can put it on because you've already approved the bracket placement, and you just double check it before they tie it in. Super, super easy. Anyways, let's go back to frequency of appointments. So like I said, in those initial round wires, I'm going to see them about every 8 weeks. Could be 6, could be 10. I say 8 because it's between 6 and 10, which is my frequency. Certainly not more than 10, not less than 6 unless there's a broken bracket, because there's just no benefit to that. And then once they get up to that 18 niti, which is no longer deflected, we go take the progress panel, we evaluate the bracket placement just to make sure it's fine. It's usually fine as long as nothing broke and you used indirect bonding. If you use direct bonding, forget it. We're probably gonna have a big mess and we're gonna have to fix that. And then we stay again in that wire until all the repos are done, expressed, and relaxed, and we go through that cycle again if we did a repose. Once that's all good, then we're gonna move on to the next phase. Remember, the first stage of any straight wire is always level and align. What a lot of these short-term ortho companies and other bracket companies or straight wire education companies, they totally teach you the wrong stuff. It's not what orthodontists do. We don't put power chain on in 16 or 18 niti. We don't. Why? Because it doesn't fully fill the slot, so you lose your torque and the teeth dump back. You get tipping uncontrolled, and it's unhealthy for the roots, teeth, and gums. That's why. So you do not close spaces on round wires. You close spaces on rectangular wires. And I know sometimes patients get all excited about closing spaces. They have to wait, okay? So then we're gonna move up to, after that 18 and all the brackets are perfect and everything's nice and passive, we're gonna move to 1825 niti, upper and lower. And we're gonna go ahead and have that cook for a little while, for 8 weeks, okay? And then after that, if we have spaces or we have bite issues and we need to use elastics, that's when we're gonna go on a 4-week frequency. Once we start using power chains or elastics, we're on a 4-week frequency after that, because power chains don't last that long and they have to be changed more frequently. Also, when you start closing spaces and fixing bites, there's a lot of things you need to look at. It's a little bit more iffy, in terms of weird things that can happen. So you need to keep a closer eye on the patient. So now they're on the month frequency until the end of treatment. And that's pretty much it. So starting off with 8 weeks and then going to 4 weeks once you get into those heavier wires. All right, thanks so much. Hopefully that was helpful.